Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update for the week ending September 23rd, 2021. This week, I'm going to ask a question that many folks have asked, and that is, are we seeing the current wave coming to an end, or at least is it slowing down? And I'll tell you right now up front, the answer is yes, probably, but it doesn't tell us much about the immediate future of the pandemic. So why do I say it looks like this wave may be coming to an end or at least slowing down? Well, if you look at global deaths, global daily deaths, you can see this decrease there over the last couple of weeks now, pretty consistently coming down. And in fact, it looks like the size of the waves have come down a little bit since December. So we're somewhat optimistic that it looks like this particular wave is slowing down. If you look at total cumulative deaths, almost 4.75 million deaths worldwide, this doesn't tell you much. So remember, historically, we've looked at the week-to-week percentage increase. And you can see early on in the pandemic, there was very high rates of week-to-week, almost doubling the number of deaths. And then it came down and has been sort of undulating downward. If you look at just this year, since January 1st, you can see it's gone up and down, but now coming down. The last couple of weeks below 1.5 or below, in fact, the last 3 weeks, 1.3, 1.3, 1.4 are the lowest sustained growth rate we've had. Now, still not very low. We'd like to see 0.1 or less, but at least it appears that globally it's slowing down, at least for the moment. In terms of the United States, you can see it's leveling off. We're not absolutely sure yet that this wave is slowing down, but it appears to be. If you look at the cumulative deaths in the US, we're now at about 700,000 deaths. There's a little uptick here. Remember, this is cumulative deaths. So what this tells you is in the last couple of months, we have seen an increase in the number of deaths in the country, and that's certainly true. If you look at the percentage increase, again, this same kind of up and down wavy pattern. If you look at just since January 1st, it came down pretty low, 0.4, 0.3, 0.3 for a number of weeks. Then it picked back up over 1% where it still is. It looks like there's some suggestion that it's now coming back down, but still this is pretty high. In terms of Tennessee, again, the same pattern. We're not absolutely sure it's coming back down, but it may be. And again, almost 15,000 deaths in our state alone, the same uptick in the last couple of months. And a 3.2% growth rate in the last week. So a little bit higher than the nation overall and quite a bit higher than globally. In terms of our region, Ballad health hospitalizations do appear to be coming down. This a couple of weeks now, the total number has been coming down. So is the current wave coming to an end or at least slowing down? Yes, probably. But it doesn't tell us much about the future of the pandemic, because the one thing we know about the pandemic is that the pandemic evolves both in terms of geography and in terms of time. In terms of time, you can see this again. This is the same slide I showed earlier. The deaths undulating, the sawtooth pattern over time. So the pandemic comes and goes, if you will. But we also see the same thing geographically. So this takes us back to the beginning of the pandemic over here. Early on, most of the deaths were occurring in Europe and a little bit in North America. Then over the first summer, it was South America. Then towards the end of the year, when that big spike happened, huge increase in Europe, some increase in North America. They both started to come down as South America picks up. And then we start seeing some cases in Asia and the Middle East. More recently, we've seen this resurgence in cases in North America. So think of it as a pandemic that evolves both in time and in space. Now, this chart, you've seen this before, but I'll show it again. This is the evolution of cases per capita in the United States all the way back from the beginning. And we put this into motion. And you can see the first deaths started to happen in the cities. It sort of exploded around the cities. And then in the late summer, we start seeing this expansion in the Southeast, increasing deaths. And it almost looks like it's moving up into the upper Midwest, bouncing off the Canadian border, coming back down. Huge problems in January. And then by March, April, May, June, it seemed to be slowing down. We thought maybe we were out of the woods, and then it starts exploding again in July and August, as bad as it ever has been. So this is hotspots for cases in the U.S. right now. You can see it's largely here in central Appalachia. Again, this idea that it's moving up and in. Hospitalizations and deaths are still high in Florida. So the pandemic evolves both in terms of geography and time. And so while it may be slowing down right now, that doesn't tell us very much about what it's going to do in the future. Additionally, it's worth remembering that even if it is slowing down, as it appears to be, it is still killing people at an incredibly high rate. Worldwide, we're seeing these deaths. The daily deaths are higher than at any time prior to last November, almost 60,000 deaths in the past week. In the US, deaths higher than almost any time except in the very beginning, and then in the wintertime, over 10,000 deaths in the past week. And then for Tennessee, this same pattern, the highest number of deaths, 450 deaths in the past week. And then for the Ballad service area, even though it's coming down, it is still higher than it's been at any time, including last winter. And so I want to end by saying something from Ballad Health, because I think it's very illustrative. All right. As of 2 days ago, 93% of the COVID inpatients had not been vaccinated. 96% of those in the intensive care unit had not been vaccinated. 99% of those on ventilators had not been vaccinated. If you were a gambling person and didn't know anything about the science or the politics of this, you'd look at these numbers and say, the winner is the vaccine. All right. That's reality. And in the end of the day, what's going to determine the future of this pandemic, I believe, is whether we can get people vaccinated in our country and around the world. Great deal more information about COVID-19 on the College of Public Health website. If you know of anyone who'd like to be added to the mailing list, please let us know. We're happy to add people. Thanks, as always, to Dara Young for editing, producing, and posting this video. And thanks to you all for your questions. If you have any questions about what I said today or any topic you'd like to see us address, please let me know. I look forward to hearing from you. Thank you very much.